Namaskar and welcome to Sansad Television. I am Vishal, Dahiya, and you're watching our show Perspective, where we bring you detailed analysis of key national and international issues. Today's Perspective is a budget special show where we're going to talk about the health infrastructure and how to give a further boost to this infra. Now, as the COVID pandemic continues, people have started prioritizing their health over most other things. This pandemic, especially during the Delta wave, exposed several gaps in the healthcare system and the infrastructure. In view of these challenges, the government then announced various policies like the PLI scheme for domestic manufacturing of active pharmaceutical ingredients, that is APIs, and the National Digital Health Mission, NDHM. In the union budget for the financial year 2021-22, that is last year, an amount of 2,23,846 crore rupees was allocated for expenditure on health and wellness sector. This comes to about 6.43% of the total budget provision. The National Health Policy 2017 also envisages raising the government health expenditure to 2.5% of the GDP in a time-bound manner. Now, the healthcare industry is expecting a rise in the centre's budgetary allocation towards this particular sector and more public-private partnership to strengthen indigenous manufacturing of essential equipment and a focus on the rural health infra as well. How can the health infrastructure be further strengthened, and what should be the key focus areas in the health sector for the forthcoming budget? For more on this, we're joined by a distinguished panel of experts. Let me first introduce them to you, beginning with Ms. Preeti Sudan, who's joining us, former Health Secretary in the Government of India. Dr. Naresh Trehan is also joining us, Chairman and Managing Director of Medanta, the Medicity, and Mr. Krishnan Ramachandran, MD and CEO at Max Bupa Health Insurance, is also with us on the panel today. Welcome, all of you, to Sansad Television. Let me first begin by trying to understand, and for our viewers also to make a sense of where do we stand in terms of the health infrastructure, and what are the lessons which we have learned over the past 2.5 crucial years when we have fought this battle against COVID pandemic. Let me begin with you, Ms. Sudan. Let's take a stock of the situation first.
So I would say that in the last 2 years, we have all understood the priority of healthcare services, individually, collectively, and I would say in public space. That is why, as you said, last year's budget did do justice to the allocations and to the health ministry. Now, it's not just the allocations which are important, I would say, but it's what are these allocations for? That's important. So you are aware that this Pradhan Mantri Ayushman Bharat Health Infrastructure Mission scheme, which has been announced last budget on 1st February 2021, with an outlay of 64,180 crore over 5 years, up to 2025. That sets the stage for a very comprehensive healthcare interventions in terms of increased investment in public health, world-class infrastructure to prepare India for future pandemics, making all districts self-reliant for surveillance, diagnostics and treatment, and comprehensive capacity building. So I think it's a very right way of moving forward in these difficult times.
Okay. Dr. Trehan, your views there on where do we stand in terms of the health infrastructure? We have, of course, there is always a room for improvement, and a lot of steps have also been taken in. But the key takeaways, which most of us have learned these lessons during the past 2 years.
Are you asking me only?
I'm asking Dr. Trehan. Dr. Trehan, can you hear me?
Yeah, I can hear you. Okay. So basically, there are two ways of looking at our infrastructure and our facilities that are available to the public. So one is that infrastructure that is on the ground already needs to be actually made. The utilization should be efficient, and wherever there is antiquity, then we should actually upgrade it. Because that becomes a short solution. Because when you start doing greenfield infrastructure building, it will take 3 to 4 years for it to come into midstream, and that we cannot afford today. So what has happened today is that we are suffering from a dual burden of disease. We are still reeling under the communicable diseases, and also along with that we have a big burden of non-communicable diseases. Having said so, we have a lot of schemes that the government has put in place to try to improve the hygiene and the infrastructure on the ground by way of the Swachh Bharat and Swasth Bharat schemes on the ground. The second thing that comes is, so the first priority for us should be to decrease the disease burden.
Okay.
The second should be that we must have early detection of disease process in any given individual. And when we have this concept in Ayushman of 150,000 primary centers, like what we call wellness centers, once they become operational and actually connected technologically through video conferencing and all that to the higher centers, there will be a ground change in our ability to diagnose disease and people in the rural area to be able to access at least early diagnostics.
Okay.
So if we have those two things in place over the next year or two, and enough budgeting is done for it and enough execution is done, there will be a significant difference on the demand on the infrastructure by way of hospitals and hospital beds. So in other words, if you have a healthy India, you need to have less expenditure on infrastructure. The second thing is, there is a lot of infrastructure on the ground, and this is what pandemic has brought us, that it has broken down the barriers between private sector and government sector. Unfortunately, before that, there was a lot of, suspicion, you can say, or mistrust, you can say, between the two sectors, and one was always trying to denigrate the other. That has disappeared. It's a big spin-off
Indeed.
of this experience that we all went through in the second wave. And I think that if we continue that mindset, if we continue that openness that this is a national problem and we are in it together, we can actually conquer much faster at much lower cost and utilize the facility that may be lying vacant anywhere.
Okay.
Because it's not only just the buildings that matter, it's actually the human capital which is even more important.
Indeed.
So I think leveraging whatever is on the ground and leveraging the maximum efficiency of those facilities and human capital will change right away a great degree the kind of healthcare we can deliver today.
Okay.
Then, of course, the government took the initiative Ayushman, which is an excellent scheme, has brought 50 crore people into the stream, which is great, because those people were really suffering and sinking under the burden of healthcare.
Indeed.
Now you say the tertiary care and the upper end, which is more sort of intense in technology, more inputs required, more expensive inputs required. How do we cover that? Unfortunately, we do have a robust healthcare insurance industry. They need to be actually reinforced. They need to be given subsidy. One of the things that one can come up with is what is costing the patient is GST of 18% on insurance premium.
That's a very interesting that's a very interesting point which you're making, Dr. Trehan. And since you mentioned the insurance part, I'd like to bring in Mr. Ramachandran here as well. Mr. Ramachandran, from your point of view, and we'll come back to those aspects as well, where you're talking about tertiary healthcare, Dr. Trehan, but looking at the insurance sector also, the health insurance sector specifically, and it is a very integral part when we're talking about the overall health infrastructure or the overall, health sector, Mr. Ramachandran. Out-of-pocket expenditure is something which is causing a lot of not only economic burden on the individuals, but also on the country as a whole.
Yeah, no, I think just to take off from where Dr. Trehan left, and thank you, Vishal, for having me on your show. There's two aspects to the health infrastructure, as you rightly pointed out. One is the infrastructure around resources, around hospitals, clinics, and the ability to deal with the twin disease burden, as Dr. Trehan referred to. And the other, of course, is once you have delivery mechanisms in place, how do you make sure that people have access? And that's where insurance comes in, whether it's the Ayushman scheme or private health insurance. And clearly, if you look at it in terms of the state of insurance in our country today, Ayushman reaches out to maybe 500 million Indians. All told, factoring in for all kinds of insurance, ESI, CGHS, Ayushman, and private health insurance, the view is that there are maybe 350, 400 million Indians who have no ability, no financing, so to speak, to access the rest of the healthcare infrastructure, right? So I think the urgent need is to make sure that we universalize financing mechanisms, be they health insurance, be they government-sponsored programs, to make sure that people are able to access the strengthened infrastructure that both Dr. Trehan and Ms. Preeti Sudan spoke about. And clearly, I think there are 2-3 ways to make sure that we universalize health insurance. One is to make it more affordable, and Dr. Trehan referred to the 18% GST. And this impacts the out-of-pocket spend in 2 ways. One is, a large part of healthcare spend is actually outpatient. And when you think about health insurance today, it's largely focused on hospitalization. And one of the reasons why outpatient is not covered is because of the 18% GST when healthcare is tax exempt. So this is a fairly big anomaly in terms of being able to make affordable health insurance available in general and specifically for outpatient.
Okay.
Secondly, I think awareness continues to be a challenge. There was a research that was done by CII and BCG that suggested that even with Ayushman, although the scheme touches 500 million Indians, we need to do more collectively to increase awareness about the scheme. And I think, we've always had this challenge of healthcare, who's in charge in the sense of making sure that we have standardization, given that it's a state subject. I think that's also an aspect that needs to be addressed as we think about, universalizing healthcare and health insurance in our country, Vishal.
Okay. Ms. Sudan, do you agree with Mr. Ramachandran out there? And of course, Dr. Trehan also mentioned that part, that as far as, limiting or bringing down the out-of-pocket expenditure on health services vis-a-vis the common man or the individual citizen, the focus needs to be a bit more on the health insurance sector, and suggestions coming in out there to make it more affordable.
So what I would say is the following. See, now, if you analyze out-of-pocket expenditure, then the maximum expenditure is actually on essential medicines. It's on OPD services. Then there is catastrophic expenditure on if a person is hospitalized. That's my understanding. Now, as far as hospitalization is concerned, both in the secondary and the tertiary care, there is now, I think, very robust partnership between the private sector and the government, which Dr. Trehan also highlighted. Many of, during the second wave, you may be aware that many of the state governments had actually partnered with private hospitals when there were capacity constraints in the government sector. And another thing I'd like to highlight is that over the last, I would say, 6 years, there has been tremendous, investments in secondary and tertiary care both. So let me just begin with saying that, 22 aims sanctioned. Undergraduate courses have already started in 18 of them. Then you have 157 medical colleges that are going to start with the district hospitals. They are already sanctioned. Then you have these upgradations. So all these things have actually in the tertiary and in the secondary care added a lot of capacities. The PG seats have increased by 78%. The UG seats have increased by 72%. So it's tremendous. Now the gap in the primary sector, I think, as Dr. Trehan also indicated, is now being plugged with Ayushman Bharat Health and Wellness Centers. So here, again, this double disease burden, I think India is one of the very few countries that has put in place a mechanism for preventive and promotive healthcare. So it's an integrated concept. Fit India, then Eat Right, and then NCD screening, non-communicable diseases screening in the Health and Wellness Center for 5 diseases.
Okay.
Diabetes, BP, then 3 cancers, oral, cervical, and breast cancer. And then, the clinical pathways all are defined. And as he said, by 2022, this year, when we have 150,000 health and wellness centers, certainly. And mind you, in these centers, you also get free essential medicines. So that's it, because we do not find private sector in primary healthcare, unfortunately. And yes, there are constraints, as Dr. Trehan also said, maybe GST is one of the reasons. We need to go a little more into it, because this is not a sector that will give you profits. This is more, the primary healthcare. That is why the burden across the world for primary healthcare largely lies on the governments. It is more in the public domain rather than in the private domain.
Okay.
As far as insurance is concerned, I think we need to dwell into reasons of why and what to do to ensure that it expands further from hospitalization down to primary and healthcare also.
Okay.
So we will need to do this. I hope that the IRDA is considering all those factors. And I think Mr. Krishnan, if he has any suggestions apart from GST, or he could give it to us so that we could send to the government for consideration.
Okay.
Thank you.
Fair enough. Those are aspects which need to be further analyzed, as well as you're pointing out, Ms. Sudana. Dr. Trehan, I'd like to come back to you. And in your initial response, you mentioned quite a few aspects in terms of a bit more focus on secondary and tertiary healthcare system, integrated mechanism, as well, augmenting the diagnostic capabilities, and of course optimum utilization of human resource in the health sector. But apart from that, 2 more areas from which we would like to understand from you. That is, one is health research, the other is indigenous manufacturing of health equipments and medicines as well. So what more needs to be done there? Because there also the PPP model seemingly will give better results.
So, India is already the pharmacy to the world, because the drug manufacturing is actually quite robust and also moving along. Although what the problem has been, because of lack of financing, there is no or very little original molecular development which is required as to go as inputs into drug manufacturing. So that needs to be really pushed very hard, so that we can upgrade our production along frontier medicines rather than only doing what we call copycat or generic medicines. So that's one part, of course. The other part you must understand is that now that the size of the healthcare sector in India is large enough to support local manufacturing. In the early days, it used to be because the depth of the market was not there, and the critical mass for requiring new technologies, new or even consumables were all coming from overseas, that the Indian medtech industry now is on the move. And so the fact the incentives given by the government, the actual encouragement by the government for the medtech industry into Atmanirbhar is a very good movement. So I think there are lots of initiatives already in place which we need to capitalize on. Ultimately, there is an aging population also. That demand will increase, will keep increasing. And as we move forward, 20% of India's population by the year 2025 is going to be aging. So now the point is, one, there is one dictum we live by, which says it is better to predict and prevent rather than repair and repent. So if we follow that dictum in our healthcare system to actually concentrate on all these 4 aspects, we will really be able to move India to a new level. Don't forget, what is good for India is good for 4 billion people around the world.
Around the world as well.
Because there are countries, there are regions, there are continents which are economically and education-wise and health facilities-wise far behind from India, maybe 10 to 20 years behind, like where India was 20 years ago.
Mm-hmm.
We have the best brains, we have the best skills. As you can know, Indians are providing 30% of the doctors to NHS in UK, and 17% of super specialists in the US are Indians.
Mm-hmm.
So you know that we have made a mark everywhere. And I worked with all nationalities. I was in the US for 20 years, and I can tell you with huge confidence that the Indian brain and skills are better than anybody in the world. I can say that with huge confidence. So if we have that human capital available, we have the will to move forward, nothing can stop India.
Indeed.
And we just had a seminar on with the DPP-IT on India to 2047. So you will see India will be a real superpower by that time, and by the time we are 100 years old.
Okay.
But the point is, all the things that have to be put on the ground have to be done today and materialize over a period of time.
Indeed, it will.
So I think I'm very, if you can get the sense of me, I'm very optimistic about India. I'm very optimistic that we will find our place in the sun very soon.
Indeed.
And also, if the government is responsive in policies as we move, because nobody can change. Nobody knew the pandemic would come and hit us so bad on our head. But, the government was agile in responding to it. And if we continue to do that, I think there is nothing to stop India from being one of the
okay.
main leaders.
That's a very, indeed, that's a very optimistic viewpoint which you are putting forth, Dr. Trehan, and that involves a lot of work to be done by all the stakeholders, as you mentioned earlier also. Mr. Ramachandran, concluding comments from you, and apart from the insurance sector, the health insurance, which we earlier spoke about, in terms of what the expectations are when we look at what the government will not only allocate in terms of money, but also where it's going to spend it.
Sure. No, I think just to take off from what Ms. Preeti said, the reality is that, and when I look back on, and Dr. Trehan also mentioned this, I think all players, private, public, came together in the cause of the nation, during COVID. And just to put that in quantitative terms, the health insurance industry, all players put together, paid out nearly 30,000 crores worth of claims on COVID alone. So as a mechanism to access high quality healthcare, such as Dr. Trehan's institution, health insurance is clearly playing a role. Mm-hmm. And how do we make sure that we universalize this? Ma'am, I do have a few suggestions. And this is also responding to your point, Vishal. Firstly, I think awareness needs to go up dramatically. And I think nudges and incentives from government side can help. We spoke about, the GST 18%. The other thing is, nudges and incentives in terms of tax benefits. I think this is a product where the cost is today, the benefits are unknown and into the future. So behavioral economics does suggest that incentives and nudges can help in terms of helping people make this choice, and government and policy can play a big role in orchestrating a set of nudges, tax incentives being a very, very powerful nudge to make sure that people buy this product, today. Other than that, I think the Ayushman Bharat Digital Health Mission lays out a great framework for what it takes to build out outpatient health insurance products in our country, from data to standards to technology, including technology which is private and secure, and all of that. I think those elements are critical, and the faster we are able to implement that. It is currently on a voluntary basis, but policy and nudges to make sure that this comes into place sooner than later across the states of India, I think will dramatically fast forward the cause of universalizing health insurance and therefore access to healthcare.
Okay, fair enough. Those are very, very interesting and important suggestions they are coming in. Thank you so much, Mr. Ramachandran, Ms. Preeti Sudan, and Dr. Naresh Trehan as well for sharing your views and insights. There it is, as our experts were pointing out, the key areas to look out for or focus on in not only this particular year, or that is the next fiscal year, but also a few years down the line as well, if we have to put in place robust health infrastructure there, and also expectations from the union budget, which will be presented on 1st of February. We'll come back again with more details. Till then, keep watching Sansad Television. Thank you.
The world's largest democracy on the far